Hi, this is Dr. Kurt Wohler for Functional Medicine Clinical Rounds. This is a case study review video example. The title of this short video is a case study, Restless Leg Syndrome and Fatigue. So this is a 67-year-old female whose main complaints are restless leg syndrome and fatigue issues that have been going on for quite some time, many years in fact. And don't show any signs of letting up. So in addition to the fatigue, this is the type of fatigue that's not really helped by sleep. And so there's also an insomnia pattern. She complains of brain fog. There's a history of hypothyroidism, chronic dry eyes, etc. Now, this is an individual that does live in a farming community. So one of the things that would be concerned about is just chemical exposure. So they did an organic acids test. This is an organic acids test from Great Plains Laboratory. And a few things to highlight here is we've got one marker, number 2, which is linked to Aspergillus mold. So we can see that there's some mold exposure. We've got an overgrowth of Candida that is evidenced here by arabinose. We also have a Clostridia bacteria problem, specifically Clostridia difficile. Now there's many different species or strains of Clostridia difficile and many different species of Clostridia. But all of these could be a contributing factor, certainly to underlying health issues, gut problems, and even fatigue. With regards to the Clostridia, certain strains of Clostridia difficile produce this chemical called 4-creosol. And 4-creosol actually inhibits this enzyme called dopamine beta hydroxylase. When this enzyme becomes inhibited, we start to see an increase of dopamine and then the metabolite called HVA. HVA is what's being measured on the organic acid test. And then there's another chemical, VMA, which is also being measured on the O test as well. And too much dopamine within the nerve cell causes free radical damage. It actually can deplete glutathione levels. It can increase neurodegeneration because it causes a lot of oxidative stress. Too much dopamine through the action of this chemical called dopaminoquinone can trigger apoptosis of nerve cells. So it can have basically a neurodegenerative effect for individuals with chronic Clostridia bacteria and elevations of 4-creosol. Now, Clostridia bacteria are anaerobic, and there's many different types. Not all of them cause digestive problems. They form spores, and these spores are highly resistant to treatment. So antibiotics, botanicals, even probiotics have a difficult time killing the spores. And one of the things that happens with Clostridia bacteria across the board is there's a high recurrence rate. This is an example of using flagyl or metronidazole to treat Clostridia. We can see it helps as the Clostridia markers drop, but because it's not cleared completely, it has a tendency to come back. So again, very high recurrence rate. And so there are various ways of dealing with that through antibiotic therapy, through botanicals, probiotics, that can be helpful for Clostridia problems overall, as well as underlying yeast issues and even mold exposure. A couple other areas on the organic acid test worth noting is this person has an elevation of a chemical called succinic. And succinic has a strong association with chemical exposure. This is indicating mitochondrial dysfunction. Mitochondrial dysfunction can certainly be a contributing factor to fatigue. The neurotransmitter section has a couple things of note. So we see a slight high normal level of this chemical called homovanillic acid. Well, that's linked to dopamine. And we see low normal levels of the VMA, which is linked to norepinephrine. And what happens is that dopamine gets converted to norepinephrine through the actions of an enzyme called dopamine beta hydroxylase. And in the presence of Clostridia, that enzyme becomes inhibited. At least that's one of the more common causes. So lack of norepinephrine as well as epinephrine could be a contributing factor to fatigue. There are also individuals who have polymorphisms, genetic variants in their dopamine beta hydroxylase. And so that will be left for another discussion because there's ways to test for that. And then, on the nutritional marker page, which also looks at folate metabolism and fatty acids, we can see a slight elevation of ascorbic acid. That could be through supplementation, for example. We see high levels of pantothenic acid. Again, that could be from supplements. We see a marker called methylsuccinic. The level is just kind of slightly high. This could indicate that there's just a little bit of a problem in metabolizing fat at the cellular level, and that could also be a contributing factor to mitochondrial imbalances as well. This individual also did a glyphosate profile. Glyphosate is a common herbicide. We can see initially it was quite elevated, and then through changes in diet, trying to eat more organically, trying to stay away from GMO foods, as well as not using glyphosate on their property, the levels did drop. The one thing about glyphosate is it can increase potential for opportunistic bacteria and yeast in the digestive system. They did a toxic non-chemical profile. This comes from Great Plains Laboratory as well. Okay, and typically it looks at a wide variety of chemicals, including MTBE, which is linked to gasoline exposure. As we go through this test, we see a few others that are slightly high. Perchlorate is common in municipal water supplies. It's a thyroid inhibitor. So this individual does have low thyroid function. Propylene oxide, quite elevated here, almost 5 times the 95th percentile. And it is considered a human carcinogen. Many of these things are also toxic to the nervous system. They use this often as a fungicide in food that's wrapped in plastic. 1,3-butadiene linked to petroleum exposure. Okay, it is a central nervous system toxin as well. And then we've got slight elevation of organophosphate. That can cause developmental problems, neurological problems. This is a very powerful and toxic pesticide. And so this person does live on a farm or in a farming community. 2,4-D is linked to an herbicide. Okay, this particular one has actually been linked to peripheral neuropathy, weakness, nausea, and ALS, so amyotrophic lateral sclerosis, has been something associated with 2,4-D exposure. So some suggestions at this point, just to initiate further intervention and testing. One of the things to consider is a mycotox profile from Great Plains Lab, because we did have that marker on page 1 of the organic acid test that showed that there was some aspergillus exposure. Aspergillus can produce a number of different mycotoxins that can be contributed to fatigue as well as mitochondrial problems, neurological issues. There is some evidence that low levels of ferritin have been associated with restless leg syndrome. Certainly nutritional deficiencies, perhaps to consider, other things to look at, magnesium, for example. It'd be worth addressing the candida as well as the clostridia. Mitochondrial support would certainly be beneficial. This person also had low levels of serotonin. They have some insomnia. That may help in part to support serotonin and melatonin. Can never go wrong with, just having filtration system on your home to decrease chemical exposure, eating organic produce, and then supporting detoxification as well, because many of these chemicals are improved in their detox through things like glutathione. A couple other things with regards to restless leg syndrome, or at least one important thing, is it has been shown in certain individuals with long-standing restless leg that it may be a sign or one of the first signs of an underlying developing neurological disease. So if you have somebody in your practice that you've been working with who has this problem and it's not resolving, and they've not seen a neurologist, it is a worthwhile referral to make, just to make sure you're not dealing with some, developing disease process within the nervous system. So any additional questions you have about this content in this video, you can reach out to us within the Functional Medicine Clinical Rounds website through either the member forum or the lab advising service that we have. Again, this is Dr. Kurt Wohler for Functional Medicine Clinical Rounds. Thank you.